see that my left hand is higher than my right, and consequently it's tighter right here. And what does that mean? It means the gluteal fold isn't always a 100% indicator, but the bones, that's 100%. So we've started, you see, we just start on the sides and then shift downwards and our fingers stop. And right here, once we've found it, let's say, here, we go in. If the fingers on one side stop, then right at this spot, we make a mark. Similarly, we also go into the soft tissues and shift down just a little. After that, we lift upwards, and here's our mark. So now we can draw the iliac bone in this way. Here we place our hand like so. See, nothing is visible here. It looks like a flat surface. But if we move our fingers like this, we'll feel that there's some kind of bony peak there. It's right here. So now we can feel for it precisely, like this, once we've identified it, right here. This is this thing here. This thing, the posterior superior iliac spine. Spine. The word for spine in Latin is spina. Why am I going to burden you a bit with these terms? Because the literature is literally full of them. And so that you can at least somewhat orient yourselves, because spina gives us spinal, and the ligament there is the sacrospinal ligament, and the pain there as well. And we find these spines in other places too. And you can see how the bone goes here to this position, and accordingly here we extend the line right to this landmark that we've palpated. And here we have the contour of the iliac bone. Understood? We do the same thing on this side. We can start by also palpating this bone, the so-called spina iliaca posterior superior, right? The posterior superior iliac spine. Well, you have to show off your knowledge sometimes. There. You can see that this one isn't quite level either, right? And here as well we bring our hand in. Here we palpate, and here we have one. Well, it's clear that with a certain amount of skill, I already do all this quickly. Here I've sunk into the tissue and shifted, and there it is, I found it. But when I find it, I lift upwards, and that's how I can see where it is. And here's the bone coming right to this point. There. So here are our pelvic bones, so to speak. You see, right, that the left one is a little bit high.